So from injury and from work-related injury, we turn the next slide, to violence-related injuries, assaults, and homicides. And if we can go to the first data slide, what is striking in this, looking at homicides by sex and age, is the curve here for males, and how much higher this is starting in age 15, and then peaking at age 24 or so, and then declining again. If we hone in on the box, the table, and look at homicides in males aged 20 to 24, the other striking feature of this graph is the rate in black males aged 20 to 24, which is on the order of 20 times higher, a little bit less than 20 times higher than it is in the white population and the Asian population. Going to the next slide, okay, we can look at again the ages 15 to 24 and homicides, and look at the method. And again, what's striking here, both for males and females, is the red part of these pie charts, which represents deaths or homicides using firearms. Cutting and piercing is much less, and the other methods are much less than firearms. If we summarize this on the next slide, we can summarize this as really the burden of violence in ages 15 to 24. About almost 47 homicides and 585,000 assaults. Okay. We look more at the assaults on the slide following. These are assaults that were picked up as treated in emergency departments, and again by age. This reflects the figures that we were just looking at, with the peak being in the 18 to 24 age group, and then the decline, very much what we saw earlier. Again, let's look at another aspect of this and look at violence against children and adolescents. One of the most surprising figures in this, I think, is children's exposure to violence. The overall exposure of children to violence, this is either directly or witnessing violence, is over 50%, almost 55%. It's really a striking figure. We can see how this varies for male and females. Even though the male figure is higher than the female figure, we're still talking about a figure that's over 50. That's well over 50%. We can see by age that the exposure, the probability of being exposed increases by age, and we can see that there's a difference by race. But these differences are not statistically significant, and they're relatively the same, which I think is another factor that some might find surprising. One aspect of violence is shown on the next slide, and that's bullying. Bullying on school property, again, has a very high, I was surprised by this when I saw it, that we're talking about a total that is at 20%. The target here is 17.9%. Another surprising figure here might be that the figure for females at 22% is higher than the figure for males at 18%. While the figures decline by grade, we're still talking about a figure of 15% having experienced bullying on school property in the 12th grade. Still, another aspect of violence is physical fighting. Okay, this figure is over 30%, the target being 28.4%. Figure here is higher for males than it is for females, and we also see the gradient in, if you will, the right direction, by grade, but we're still talking about a minimum of over 25% in grade 12. Okay, if we break this out by race, we see there are differences by race, but I think it's important to look at the Black, Hispanic, and or Latino and the white figures, and see that these figures still are well over 25, or essentially over 30%, or close to 30%. So it's really a significant figure. It's a high figure. Now, again, another piece of this this important area is work-related violence, focusing on assaults and homicides. So now here we target, even in a more narrow way, at work-related assaults by industry rather, treated in emergency departments. Again, surprising figures, at least they were to me, is that public administration and healthcare are industries that rank the highest here in terms of the rates of work-related assault injuries. If we go to the next slide and we go from injury to homicide by perpetrator type, these again are work-related homicides by perpetrator type. The large blue areas represent homicides that were committed during robberies. And if we then look at what type of work setting in the next slide was involved, these are all work settings that we would think could well be the victims of robberies, ranging here from supermarkets up to the highest figures for restaurants. This brings me to the last slide on key points. And I point out here that all of the slides, I think, showed us that when we look by age, that younger age groups are disproportionately impacted by injuries by the non-fatal injuries in both work and non-work environment. I mentioned that half of all children and adolescents have been exposed to violence. I think it's a surprising and extremely important figure. Third, the burden of violence extends beyond homicides to include non-fatal physical assaults and bullying, and that the patterns differ by age, by settings, by race, which calls for the need for targeted prevention strategies that are particular to each of these. And I'd add to these bullets the rise of poisonings in injury, an extremely important point that really has only been recently pointed out, and the role of drugs, legal and non-legal drugs.